What are shoulder bone spurs? Bone spurs are overgrowths of bone that commonly form in the edges of bone or where bones meet other joints or other tissues like ligaments or in muscles. Bone spurs can be smooth or sharp. Bone spurs are also known as something called osteophytes. Now, bone spurs can develop anywhere where a bone meets another bone or within a joint, but the most common location for bone spurs include shoulders, spine, hips, knees, and feet. Sometimes it can also occur in hands. It tends to focus more on parts of the bones or spine or body that bears weight. So the joints that bear more weight are more likely to develop bone spurs than areas that don't. Bone spurs commonly occur or form when the body is trying to recover from some type of joint injury or joint damage. The diagnosis is typically associated when you see a bone spur as something called osteoarthritis. Shoulder bone spurs can be caused by a shoulder injury or from repetitive lifting heavy objects overhead or some kind of strain in the shoulder or the upper back. Some bone spurs don't produce noticeable symptoms. However, this is particularly new when they're newly formed. And in some cases, bone spurs may only be discovered during an x-ray for another reason, like you could have a flu or a cold and take a chest x-ray, the shoulder's involved in the x-ray, and they can see a bone spur. Symptomatic bone spurs can cause shoulder pain and discomfort when bone spurs start to cause symptoms. However, not every bone spur is symptomatic. Swelling, inflammation, shoulder stiffness is also common and it's typically associated with a particular movement. As you move the shoulder, the bone spur can irritate something and cause some kind of pain. You may also notice strain sensations in the shoulders like tingling or numbness, and this is when the bone spur happens to impinge some type of nerve tissue or some kind of nerve that's exiting through the shoulder down into the arm. If the pain radiates across the upper back and down the arm, it's definitely a result of nerve compression, and that can happen from the shoulder pressing on the nerve, or it could be coming from somewhere else. Bone spurs can develop in any part of the shoulder, but the parts that experience the most heavy use are definitely the most vulnerable. Bone spurs can develop in the shoulder joint. This is the glenohumeral joint, and they can displace the humerus from its natural position. This can lead to shoulder joint pain, joint instability, and in very, very severe cases, potentially like shoulder dislocation. Bone spurs can also form on the underside of the scapula of the shoulder blade, and this can affect the rotator cuff tendons, and it can also affect the shoulder gliding smoothly across the ribs and the posterior aspect of the body. Bone spurs can also form in the top of the shoulder blade where it meets the collarbone, and this commonly affects older individuals and athletes that expose their shoulders to repetitive stress. Now, we know bone spurs in the shoulder don't always require treatment, especially if they're asymptomatic. But however, symptomatic bone spurs, treatment needs to be shaped around the underlying causes. Now, non-surgical treatment options can include like lifestyle modifications, avoid certain activities, chiropractic care, specific shoulder exercises, and physical therapy. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.